Welcome back to Houston Life. If you've ever noticed leg swelling after a flight or a long walk, you are not alone. But for one Houston man, that swelling started and didn't go away.
In fact, it led to a surprising diagnosis. Mel Camp is taking us inside Reincke Vein Center in Sugar Land.
For years when I've traveled, I get swelling in my ankles and my feet. And so I started wearing compression socks to try and, fix that or abate that. But this last December when I traveled, the swelling came on and it never went away.
Hey Monica, how are you today?
I'm good.
Don Keller knew the swelling and discomfort in his legs wasn't normal. So he went to his primary care doctor to get it checked out.
You ready to come back?
I am. Awesome.
I had bad veins that were backflowing blood, causing it to swell. So I was actually referred by my GP. Dr. Trippett referred me to Dr. Reincke's clinic.
And here, Dr. Tony Reincke and her team got down to business.
It's been a great ride ever since, yeah. There were a lot of different procedures we had to do.
Don was diagnosed with venous insufficiency, a condition that even some well-known public figures have faced.
He came in, we decided to go ahead and move forward with the diagnostic ultrasound, proved that yes, indeed, at least some of his swelling was due to these incompetent, stretched out, dilated veins with backward blood flow, which was absolutely the suspicion when he came in. Got the ultrasound, proved that, of course, had to get permission from his insurance to do the procedures.
At the beginning, Don wasn't sure what to expect when it came to treatment. He feared it might be intense or even surgical.
So I was honestly a little scared. We joked about it when I first came in. I thought this was going to be some surgical thing where they flay open your leg and do all this crazy stuff. And Dr. Reincke illustrated for me how simple the procedure really was. And really, I do have a high pain tolerance, but there was no pain through any of it. There is a potential for pain afterwards as the veins begin to die away and be absorbed by the body. But even in that, I haven't had any pain personally through any of the procedure. I've just noticed the reduction in swelling and the removal of pain from my feet specifically. So we've been together for close to 3 months now, on and off, every week, every other week to do all of the different treatments that are needed. So it's been good.
30 years ago, they used to do vein stripping procedures. Vascular surgeons would take a patient to the operating room, they'd use general anesthesia, and they would strip the vein outside the body. It was a major vascular procedure. Now we do this minimally invasive procedure in the office, and we're essentially doing the same thing. We're treating the root cause of the patient's symptoms, right? But we're just doing it in a different way. We leave the vein in and let the body take care of it versus barbarically ripping out the vein and having 6-week recovery time. It's awesome. It's a great procedure.
Yeah. And then for the smaller veins,
for the smaller veins,
it didn't even require a catheterization. It was a chemical treatment in the vein. And that was like you couldn't, I didn't even feel anything.
When Mr. Keller came in, his chief complaint was, or his symptom, was that he had severe swelling in his legs. Patients will sometimes think that they don't even have symptoms and just have big bulging, like visible veins or skin discoloration. So potentially those things, restless legs, night cramps, tired, heavy, aching legs, itching, a medical term is pruritus, is the most specific, if they have it, to vein disease. So of all the symptoms a patient could have, if they're talking about itching, especially at the ankle area, and that's because there's so much backward blood flow, the force of gravity, that the pressure in their skin is going to be the highest here. There's a lot of inflammatory chemicals that get released, and that is the most specific.
I'm mature enough in life. I've seen a lot of doctors. I've been to a lot of different clinics for different things. I will say that I have had more fun here than anywhere else I've ever been in my life. It really is, it's like a party when I come in for a procedure here. We laugh through the whole thing. There are several times when like the procedure's over and we're still having so much fun. Wait, I don't want to go home yet. Let's keep yucking it up. It's a lot of fun here. So I do have a great appreciation for Dr. Reincke and for Tong and for the whole office here.
Not everybody knows, yes, definitively, I have vein disease. If you just have some symptoms or you're not sure, honestly, if you just want education, come in. I do free consultations. They're legitimately free. If you actually speak to me, I will go over all of your history, do a quick physical exam, everything's targeted, put together what I think. Even if you have vein disease, it doesn't mean you have to be treated. And I think that's really important for patients to understand. You're in control of your health, right? So you have choices. Here, we're gonna educate you. We'll talk to you about what those choices are, and then if you decide you want to move forward, I can have my team, my receptionist is phenomenal. She will help the patient with any insurance. So most procedures are covered by insurance. She will help that patient in navigating through insurance for them to make sure that they're covered for the ultrasound and procedures.
If you are having quality of life issues, your feet are hurting, your ankles are hurting, your legs are itching, you notice swelling. Or, as I told Dr. Reincke when I come in, I looked down this morning and I had my grandmother's feet. Those are the exact words I use. If you notice that, why not come in and find out, is this vein disease that's causing this in my life? And if it's quality of life, improve your life. Don't wait.
And if you'd like to book a free consultation at Reincke Vein Center, just let them know that you saw them right here on Houston Life.
Yeah, you can call 281-394-4446, or you can visit them online, ReinckeVeinCenter.com.